Just finished a great case. I did a case with body contour and liposuction, did a mom makeover, and a breast lift, and then a tummy tuck. So she has a brand new body, real excited for her. Just want to introduce one of the devices I've been using for the past, I would say, almost 9 months now. It's called Vaser, and it is a technology, it's ultrasound technology. And I'm not one to really teach this in the OR and talk and while I'm operating. You guys pay me to do my job when I'm operating, not mess around, so that's what I do. But the case is over, and I just want to kind of show you the device and how it works, because I haven't seen this out there yet. So this is called the probe, and this is what it looks like. This connects. This is the Vaser machine, and what we have here is the top unit, which is the device that distributes the energy, and the bottom here is a liposuction machine. So it's all one unit. It's just a fancy tower, but this goes into this machine here. And so I don't know if you can see this, but this is the probe that it comes with, and there's the rings, and the rings are where the energy comes out from. And this is a frequency of ultrasound. So what it does, the energy is basically around the tip, and so think of it like a mushroom. There's different number of rings. You have a 1 ring to 5 ring. The 1 ring looks like think of it like a garden hose with the jet spout, so it comes out straight, so the energy is very pointed. And the 5 rings is very, very, very round and very soft, like the one you would kind of garden, you would water some flowers or something like that. We typically use the 3 rings, so this is what I use, so the energy is kind of like this much. And so this is something you do before the liposuction, so we do tumescent into the soft tissue, and it provides a moist environment, a wet environment. It has some medication help decrease the blood loss, and it provides a facility that way we can get the fat out with the liposuction. But this goes before liposuction, and what it does is what it's going to do is it's going to release the collagen that's holding the fat cells in, and it softens it up, and it makes the liposuction happen faster. And it's less physical trauma for me, like doing the liposuction, like breaking up all that collagen and the scar tissue. You've had liposuction before, you have scar tissue, you have to break all that up with liposuction. This does it for me. And it's much more gentler on the soft tissue, and that's very, very important to understand. And that the fat cells are not traumatized as much. You don't beat them up, you're not physically beating them up. And you have less blood loss because this is just facilitating that. The energy, what it does, it kind of shakes like a grapevine. So think of the vine as collagen and the grapes are the fat cells. And what it's doing is just shaking that vine to let it loosen up, and the fat cells will basically fall off easier. Makes a world of difference, when it does a liposuction. So it's actually easier on me physically to do the liposuction now, but what's even better is that the patients have a fast recovery because they're not beat up as much as I used to beat people up, because I have a strong arm. And it takes physical force to get through that tissue. People who've had a previous liposuction before, even harder, because all that fibrosis is set. You got to get to that collagen. It takes a lot more physical trauma, and so patients will feel that. Vaser for me is changing the game. The added energy also adds a little bit of, adding energy to soft tissue. Our soft tissue shrinks a little bit, so you get a little bit of a skin contraction, which is even better than normal liposuction. I wouldn't say that's a major selling point with Vaser, but it does help. You combine that with another technology for skin tightening, and that's called Renuvion. And man, what a synergistic 1-2 punch when it comes to soft tissue tightening. This is not skin tightening, we're talking about soft tissue. And this is a device, I've talked about it before, but this is done after liposuction, and it adds energy to soft tissue, and it contracts all the soft tissue from inside the fat, and under the skin. And so everything kind of shrink wraps down. So, if you do liposuction, the skin tightening, you're gonna get about 20, maybe 20% at best. Skin tightening, you'll see things shrink down. You add Vaser, probably another 10%, and you add Renuvion, you're adding another 20, I think sometimes even 30%. This is just me being as objective as I can, but this is a super, super powerful technology of skin tightening, tissue tightening for areas of the body that have a little bit more laxity, a little more stretch marks, just looser skin. Man, this 1-2 punch is just dramatically better. And I've been doing liposuction for a long time, a lot of contouring, and I'm just so thankful now I have technology that is, for the most part, you're not adding extra incisions. It's just the same incision we use for liposuction. But the contours and the results, patient pain is less, swelling is better. I'm just super, super happy. And this is something that I do almost exclusively. I do Vaser now exclusively with liposuction for all my patients. And then if you have areas that are a little bit looser with stretch marks or just laxity, Renuvion going to help skin tighten up the skin and soft tissue a little bit better. But sometimes you do that virtual skin, and you know what that means. You just gotta kind of cut it off. But you gotta definitely go see a board certified plastic surgeon. Ask about these technologies. You know, some surgeons have it, some don't. But I'm a big fan of it. I think my patients are getting better outcomes from it. And if you're interested, give us contact. Don't forget, put your questions in my comments below. Send me a DM if you want. I'd love to answer more questions. Thank you again for following, and stay tuned for more.